There's a story that I heard a gentleman tell who worked for a pharmaceutical company that had developed a tremendously effective treatment for a specific variety of solid cancer tumor to the tune of like 90% efficacy. You administer it and it went away. And they shelved the drug precisely because it was effective.
Right.
Now, this was a private company, privately held, privately funded. And those things very well may likely and probably do happen pretty often. Suboxone was created with $62.5 million of public money. No one has any problem getting it, whether it's at a clinic or whether it's out here on the street. Now, we don't ever want Ibogaine to be available on the street because it's dangerous.
Sure.
It has to be administered in a clinically controlled medical setting. But if we can build a recovery infrastructure from sea to sign and sea and do things like pump 110 million doses of Suboxone into Kentucky over 5 years to a Medicaid population of 1.6 million people and make sure that there's a Suboxone clinic in every community that is poor, that also happens to have, you know, poor white folks and poor black folks, and that it is universally accessible, we can make Ibogaine universally accessible.
The other part about it is people have choice. We live in a free market society, right?
Right.
So I think that they've already proven that that's just a fear that doesn't exist, because when you look at organic food versus conventional,
Sure.
both of those markets exist freely, and they both sell billions, and it's almost the same. So
Right.
I think over time, the markets for that, you know, will even out. Not everybody, people are going to still choose the old ways,
Right.
and that's a choice, and that's available, you know. I mean, what we know about alcohol now, and alcohol is something that a lot of people that go through this process kind of leave behind once they go through Ibogaine and 5-MeO DMT treatment, but it's still available. It's still on the market, and people are still available to choose that. So I think that as this goes on, it'll kind of even itself out. The market will even itself out and figure itself out. But if we're talking about that we're trying to keep something from people because we're scared that something else isn't going to be as profitable, that right there is the root cause of why we're in this whole situation.
I agree completely. And as you mentioned, when it's done, because I've too heard of studies where they've found things to eradicate this disease, this cancer, this whatnot, you know, with a pretty high efficacy, and then it's not available. It goes away. It's, you know, it's altered some, so it might help some, but not completely like it could. And, or, you know, side effects are added to, you know, it could do this. And so that creates a fear, right? You know, and people don't want to do it. And you're right. You know, some people may not want to sign up for what the journey calls for, right? They may not want to sign up for not being comfortable. People don't like to be uncomfortable, and you might be uncomfortable for a day for a long-term effect, and some people can't see past that day, right? So, or, you know, we've talked about, there are plenty of addicts out there who will convince themselves I'm not an addict, or when it becomes time to take it, they back out because, you know, they don't want to change their ways. So,
well, and some people want to stay sick people,
right?
Like and that's a choice too, you know.
For sure.
And it's okay. And we live in a society that takes really good care of sick people, you know. So it's a personal choice. But the thing about it is so many people are out there naysaying everything, and we're still busy over here cutting red tape. Like we haven't even gotten inside yet, folks.
Right.
So I think it's just, we should all be excited and happy and proud that we've been shepherded this far by minds like Brian Hubbard's.
For sure.
And that everybody should just support those people. There's no way they're going to table this.
Right.
So, not if we're breathing. I believe that.